Thanks so much for joining. So we are all here today to consider the possibility of building the future of healthcare together. I'm Dr. Leah Houston, and I'm the founder of HPEC. And in 2017, I learned that a hospital stole my identity. They were using my Medicare and Medicaid PTAN numbers to bill on patients that I had never seen in a hospital I was no longer working in. Now, the Center for Medicare and Medicaid thought I was practicing medicine without a license because of this. And so I was unable to work for 5 months while I tried to iron out this legal battle. Finally, I did win a settlement agreement against the hospital because, frankly, this is fraud. And this is more common than people realize. And so, I thought to myself, like, I spent my entire youth with my nose in a book learning how to prevent death and permanent disability. And this is how I'm treated by the system. I've worked in 14 different health systems across the US over 10 years, and my career was almost ruined by a clerical credentialing error. And so, being a problem solver, I had heard about a new technology called decentralized identity. And I put two and two together, and I saw an unprecedented opportunity, not only in preventing what happened to me, but in using this tool to build a new system that can eliminate the friction and automate how we onboard and get to work and communicate as independent doctors throughout our entire career. If we fix the physician workforce problem, we fix the access to care problem. And I'm not only talking about patient to physician access, I'm talking about our access to each other, our ability to coordinate care amongst each other. When we were independent, we were the masters at this. But in this new system, with everything done electronically, that has been taken from us. So I'm really excited how we're going to share, how we're going to coordinate and automate workforce mobility, how we're going to create solutions that allow independent doctors to build their own referral networks in a very revolutionary way. And for those of you who don't know, HPEC stands for the Humanitarian Physicians Empowerment Community, because that's what we do. We empower the humanitarian physicians to provide the care that patients need. And so we're automating workforce mobility for doctors in order to make patient care safer and more accessible. But this is how we currently feel. We spend our entire youth learning how to practice medicine, and this is how we're treated. We are mostly employed now. Most of us are no longer independent. We're monitored and micromanaged by third parties to the point that we find it difficult to even do what we're supposed to be doing. We're spending our time sifting through faxed paperwork, and our computers are essentially useless, and we're no longer independent, And if you look at the patient in this room, they're feeling this too. And because we're the ones in front of them, they're blaming us and they're starting not to trust us. So it's up to us to do something about this. I know we are all sick of the uncompensated administrative burdens, and we're just, losing it and burning out and quitting and all this stuff. But this is really about our patients and about us serving our patients. So what's the problem? This barely visible sliver of a line at the bottom represents the growth in the number of doctors since 1975. Compared to the increase in healthcare spending since then, and this is by the thousands of a percent, so this is an enormous amount of an increase. And compare it to the number of administrators that are increasing, the people that were in the room in the previous picture. So with each new regulation, there's been an increase in the cost to the point that now only 30% of every dollar actually goes towards patient care. This is unsustainable. Reducing administrative burden and automating the administrative processes will make the administrators go away. And it's also necessary in order to control those costs and keep doctors in medicine. So we know that the path to becoming a doctor is long and cumbersome. Each step of training, testing, qualifying, credentialing creates friction that follows us throughout our career. And this is 11 to 18 years of training that we went through. And each step of this training has to be repeatedly verified in order for us to get and keep a job. And I'm talking about credentialing. That's what our system is built on, physician care and the credentials that say that we can do what we do. And that care is dependent on a credential verification system that verifies that we actually went through that process and we're safe to make life and death influencing recommendations to patients. So healthcare doesn't exist without this, and the current system isn't working. And before we show you how to fix it, let's make sure we understand the existing process. So we have doctors who hold credentials and get trained at places that issue credentials like medical schools, residency programs, even CMEs are credential issuing bodies. And so after all that training, we get issued a paper credential. And it's the first step in our current process. And so then we need to get to work. So some of us will open up our own solo private practices, but that's becoming less common. But even in our solo private direct primary care practices where we accept cash only and we're opted out of all insurance and Medicare and Medicaid, we still have to maintain our licenses. Our licenses require CMEs. Our licenses, our ability to prescribe controlled substances is, DEA is a credential. So we have to have credentials in order to practice, whether we're independent or employed. And so there's usually between 30 and 70 credentials throughout our career that need to be repeatedly verified in order to get and keep a job and to stay in practice. And the first step is that verifiers will make that initial request. And then we initially share our credentials. And in most cases, this data is protected by a similar law to HIPAA called FERPA, which is a law around our educational credentials. So legally, and from a regulatory compliance standpoint, we as physicians control access to all of these credentials, and in turn, we also carry the administrative burden of sharing and keeping them updated. And this is why it sucks so much for us. And so once we share those paper credentials, the verifiers go back to the issuing institution and ask for the credentials, make sure that they're real. There's regulations around this process, but there's no standards. So each institution follows its own internal guidelines on how to stay compliant. It's a mostly manual process. And so the credential issuers need to cover the administrative costs because it's expensive, so they ask for payment, and the verifier makes the payment. And this is an extremely human resource intensive back and forth process. And then the credential is finally verified 4 to 6 months later, an outrageous amount of time, costing us up to $150,000 in lost income and costing the employers and the systems an average of $1.2 million in lost revenue. So this is an expensive, time-consuming, and administratively burdensome process for everyone. Everybody hates this. And this is a tiny snapshot of the journey that we as doctors take from the day we start medical school until the day we retire. These are only a few examples of what the current siloed, centralized, friction-filled, manual systems that manage our identity and credential data that we have no ownership or control over, we have no access to as practicing doctors. None of them work well. None of them are physician-centric. They're all made for institutions. And many of them are going to be made obsolete soon due to regulatory non-compliance. And so we have the potential to replace or interface with every system you see here. So we have the only end-to-end solution that can automate the verification process and make our entire career lifecycle easier. Our system is unique because instead of handling the verification after the credential is issued, like all of the other systems mentioned on the previous page, we automate the process upstream at the time you actually receive your credential. With our 2 interoperable products, we achieve an automated, secure, user-centric, and compliant way to issue, verify, and manage identity and credential data, solving a $5 billion credentialing problem. We create a permanent solution for automated workforce mobility. And when you think about it, mobility translates to practice autonomy, not only by reducing the repetitive, redundant task of credentialing, but instantaneous freedom to prove your credentials also creates the instantaneous freedom to move out of systems that aren't serving us and aren't serving our patients. So in the end, our system makes physicians' lives easier and makes patient care safer because we will no longer be forced to stay in systems that aren't serving us, and we can find and seek out those systems that are. And so how does our system actually work? So the doctor's still going to graduate, get a paper credential, but now the day you get your paper credential, you're also going to be issued a digitally verifiable credential into your wallet. Through secure decentralized identity protocols, our system will immediately hash or document proof that that credential is issued onto a distributed ledger or a blockchain, creating a permanent, immutable, and accessible record. So now, when you need to be verified for a job and you present your paper credential, it also includes the digital credential that comes along with provenance data. That provenance data points to the blockchain, demonstrating that the credential is authentic and actually issued by the issuing institution. All of that metadata will be included in the digital credential. So immediately the verifier can read the ledger and know for a fact, instantaneously, that that credential is authentic, saving months of time and millions of dollars. And so with the power of AI and these interoperable open standards protocols, we'll develop automatic re-verification tools so the credential issuer will never, ever have to manually verify the credentials again. So you as the doctor would stay in full control and you can get to work immediately, so everybody wins. But how do we make money? So the EverCred system is purchased by credential issuers as a SaaS model. There's a setup fee, a per user per year fee. There might be feature ad options. The issuers then use the EverCred tool to issue the digital credential into the wallet of the doctor. That credential, again, is digital and automatically and permanently verifiable. So our system doesn't change the workflow. The verifiers are still going to need to verify us. They're still going to put the request out. And so you can immediately now share your digital credential that's automatically verifiable. And because you remain in full control, we are compliant with FERPA. And so now about the payment. With the digital credential comes an automatic payment request. And while we await that payment, the credential will be held under smart contract until the payment is made. So the verifier sees that the credential is there and it's ready to be viewed. As soon as they make the payment, that digital proof is released and the credential is verified. So both in our model, both the holder and the issuer will also, importantly, earn revenue for participating in the network. So you as the physician already paid for your education in time and hundreds of thousands of dollars. So you should earn money when you share your data. They're using that data to, improve their business processes. There's no reason that you shouldn't receive some kind of reward for that. So this is the way it should be, where you get paid for your data. And the issuers will still be paid as they've always been, so they're not going to lose out. But now the costs, overall costs, end-to-end costs are dramatically reduced because our system is automated and works end-to-end. So all the human resources costs are lowered tremendously. So we also as a company get a payment for providing the service. So we get paid for the EverCred SaaS model. We get paid every time a credential is issued, checked, verified, and so does everyone else. So all the expensive friction-filled systems will be made obsolete. This cutting-edge company leverages both decentralization and AI, where we're putting practicing physicians in the driver's seat. So no longer will we need to use these old centralized systems that are forced upon us. We're building systems that work for us. So those of you who join and support the company now and participate at this early stage can be rewarded for your forward thinking and for taking action towards owning a solution collectively together. And so we're creating a new marketplace in an old industry. We have two interoperable products that are both in beta and built on these open standards. The HPEC Identity Wallet allows physicians to hold, store, and share credentials, giving them ownership over their professional brand so that they can work and move freely. The EverCred system authenticates physician identity and credentials and automates regulatory compliance, freeing up valuable time and resources for both the credential verifiers and issuers. So I want everybody to understand that while we build out this new future decentralized ecosystem, we still need to make money and revenue as a company. And our system already has all of the capabilities to be a traditional credential verifying organization already. So we as a company are going to apply to do that, and that's going to be our first revenue stream. As we build out that model, we'll start to build out the decentralized ecosystem. So using open standards means that both of our systems are interoperable, but not interdependent, and they can integrate into other future systems that use these standards, including future patient identity systems. So think about the potential upside here. So the future is here, and we are right on time. And HPEC isn't just a credential data wallet. Importantly, there's a peer-to-peer social connection and communication layer where practicing physicians can use this tool to build their own referral networks that are personalized to them as individual independent doctors. These referral networks will be built by the doctors, not governed or influenced by third parties like insurance companies and large vertically integrated health systems, which frankly, they're the ones that kind of control the referral networks now, and it's not safe for patients. So we can have governance by the community, inclusive stakeholding and shared decision-making so that we can, optimize our practices for, optimal patient care. And we can also choose to make our internal profiles that are really only accessible to the physician community on the app public in the future. And we can push that data to websites that patients can look us up. So we can replace those horrible online physician search engines that scrape our data without our knowledge or consent. And because the application is physician controlled and decentralized, you control that, not us as a company. So we empower the physician community to rebuild the entire healthcare system, uninfluenced by outsiders and centered around their individual needs and the individual needs of their patients. And the total addressable market for credentialing is $5 billion, which is where we discussed that we're going to start. But the United States healthcare system, it's a $4.2 trillion system that's growing every year. And if you think about it, we, the practicing doctors, control the flow of 80% of that capital. It's the stroke of a doctor's keyboard that decides if you get admitted or discharged, if you get surgery, medication, or physical therapy. And the strokes of those keyboards also generate data. So regarding the $450 billion patient data industry, we're the ones that are generating lots of the most valuable data. And so this is how systems make money, by controlling our behavior, by controlling the data that we generate, by controlling the flow of capital, by incentivizing us with protocols. And if you think about it, we're being incentivized to hurry through patient encounters. It leads us to overorder, overtreat, overrefer. Patients are getting frustrated because they're feeling rushed. And so the data is also really dirty and our price of healthcare is artificially inflated. But with HPEC, you own your data. And so our regulatory compliance system has the power to create clean and authentic data and to integrate into our greater healthcare system at multiple levels in order to reduce fraud, waste, and abuse, and redirect capital in the direction of actual patient care. As a company, we'll get a piece from making it all possible with revenue projections in the tens of millions. So now that you know how the technology works and how we're going to generate revenue, you need to not only understand, but believe that this is possible. And this is a hurdle that a lot of people have a hard time getting over. But the industry is moving in the direction of digital verification. Right now, everyone is trying to solve this problem, and many of them are looking at the digital identity and credential world. But no other company is doing this in this physician-centric way as far as we know. So we're first to market. We have first mover advantage. There are also currently hundreds of other credentialing companies that solve this problem downstream. We're the first and only company solving this problem upstream, creating this automated digital solution. And importantly, this is a very rare moment in time where technology trends are following regulatory trends. The American Association of Medical Colleges, the Federation of State Medical Licensing Boards, all of them are looking at digital credentials as a solution. If you look on your LinkedIn profile, there's a lot of people that have digital credentials there already. The 21st Century Cures Act, the California Data Protection and Privacy Act, GDPR, these are all privacy regulations that are demanding immediate access to authentic data, and we can provide that. The no surprise billing laws, those laws cannot be properly implemented unless the data is accurate. So let's face it, all stakeholders need this, and we need it the most as doctors. And so this effort has been developed and fully funded by the physician community so far. There's been over 400 physician investors that funded this, and now the product is launched in beta with over 1,000 physician members to date, representing over 100,000 patients. We've built partnerships with credential issuers with a clear path to revenue, and we're ready to scale. We can use the system to iterate on the EverCred model, to grow the physician workforce marketplace, to make sure physicians own their data, to integrate advanced identity and fraud protection. We have the goal to have a fully interoperable and widely adopted system and capture 15% plus of the physician workforce by 2025. And we have pilot partners that include Norman Regional Medical Center and the University of Buffalo, where they're going to use the EverCred system to issue digital residency certificates into the wallets of graduating doctors. Now, until we have the distributed system, those credentials will not have proof hashed to blockchains, but that's part of what we're raising capital for. And we also have an agreement with Fingerprinting, which is a company that holds patents to do remote fingerprinting globally. So for those of you who have multiple licenses in multiple states, you realize the value of this. This is a path to potentially having some type of interstate medical licensing reciprocity. And this company already has agreements with all 50 state medical licensing boards, and it's a patented system. So we're really excited to provide them with a digital solution. And this is a sample of our physician leaders who are forward-thinking enough to have supported this movement from the start because they know it's so needed and they believe that we can do it together. And so, as we mentioned, we successfully deployed the capital from our initial investors and launched our earliest version of the HPEC app to both the iOS and Google Play stores, and we have EverCred pilot partners, as mentioned. So we're now ready to implement modifications and begin the next phase, which includes preparing the EverCred system for enterprise integration. And to accomplish this, our next round of funding is going to be $5 million, which is going to give us confidence that we can be revenue positive within 18 months. So this restructuring of our healthcare system is inevitable. It's happening with or without us, but we have the power to do it right. We've already seen what happens if we wait and hope that somebody else fixes this. Things just get worse. So with your support, we can change everything. We can rewrite the rules and take back our professional careers, our sanity, and our lives. And this is our dedicated and passionate team. Together, we can build a system that looks more like this. So we're asking you to join us today. If you haven't already, go to the HPEC website, give us your information, and share your interest so you can stay in touch. You know, we're building a very unique opportunity to have a company that's solving a complex problem in a unique way that's physician-centric. It's an absolutely revolutionary moment in time where we, as physicians, can seize our professional careers back from those who refuse to prioritize us and our patients. So if you're serious about taking back control of your livelihood and your practice, take a step to not only protect the credentials that you work so hard for, but, you know, take a step to, you know, build a system together where we can advocate and, you know, restore our practices and preserve our sanctity, the sanctity of the doctor-patient relationship, you know, and take back our professional lives. You know, I'm asking every single physician who's listening now to translate the seriousness that you have in your profession and the seriousness that you care for patients into a minimum but powerful investment of $5,000 on the day of the launch. That will get us to where we need to go and will be in alignment with our mission to keep this doctor-owned. But I want to mention that even medical students and residents will be able to participate at our minimum investment of $500. And so we've structured this opportunity to make it easy for anyone who cares about the future of healthcare to be able to take action and participate immediately once the crowdfund is live. We see this as a small amount compared to the price that we've already paid and will continue to have to pay if we continue in this old way or continue to do nothing. You know, you have to ask yourself, what's your career worth to you? What's peace of mind really worth to you? To know that there's going to be competent, qualified doctors there to care for you, your children, your grandchildren in the future. As a company, we aim to give you your time and peace of mind back along with a return on your investment, not only for yourself, but for future generations. And we want to keep this physician owned, but we want anyone to join us who thinks that this is an important mission. You know, this opportunity has been structured to make that all possible, but the rest is up to you. And regarding a date, we're not sure. We're not allowed to know, but it's likely going to happen very soon. And when it launches, there's going to be bonuses if you invest early and bonuses if you invest more. So make sure we have your info, including your phone number, so we can send you notifications. We have this one chance to take back our professional lives, our sanity, and to build a new system that serves us and our patients. So let's do it. Thanks.